This presentation is part of the Managed Outcomes webcast. Managed Outcomes is an EU FP7 co-funded project aiming to examine the regional health service provider networks in relation to health outcomes and their relationship to costs. The economic modelling draws on the findings of the case studies regarding the costs and on the findings of the patient survey regarding the outcomes. The aim of the economic modelling was to examine the relationship between costs and outcomes in order to identify which case study achieves better value for money. So, for each of the 4 health conditions selected, that is, diabetes, hip replacement due to hip osteoarthritis, stroke and dementia, costs were mapped against outcomes for each of the participating regions of the countries involved. In order to allow for transnational comparisons, euros were transformed into purchasing power standards, a standardized European monetary unit, according to the standard Eurostat methodology, by using the officially published purchasing power parities for 2009, the reference year of the data collected. For outcomes, the generic measure of health-related quality of life EQ5D was used in the patient questionnaire survey, and additionally, other specific for the health conditions outcome measures were used. Based on the assumption that the quality of life of patients remained the same during the 1 year of the study, the mean cost per quality adjusted life year for all diabetic patients, irrespective of the type of their treatment, appears to be the lowest for Keski-Suomi in Finland, followed very closely by Valencia in Spain. Valencia in Spain appears to be the most cost-effective for each of the separate groups of diabetics by type of treatment. When all diabetics are considered together, irrespective of type of treatment, compared to Keski, which is the least costly, the case instances which fall in the upper right quadrant achieve better quality of life, but at a higher cost. The steeper the blue line, the higher the additional cost per additional QALY. Keski-Suomi in Finland and Nieuwe-Waterweg Noord and Delft-Westland Oostland in the Netherlands seem to be the most efficient, while Valencia in Spain is close but with somewhat lower quality of life and only slightly higher cost. For hip replacement due to hip osteoarthritis, the findings suggest that this highly technical medical procedure is equally effective in all regions under study. Still, the organization of care delivery achieves lower cost in relation to quality of life in the Larissa region in Greece. All the other pilot regions achieve additional quality of life, but at an additional cost. Stroke, a health condition selected for its acute care requirements, was found to be most cost-effective in Valencia, Spain, due to low costs mainly, although the health outcomes were not the highest. Tilburg in the Netherlands, Keski-Suomi in Finland, and Brighton in England appear to be more costly but achieve higher quality of life outcomes. Dementia is a typical health condition which requires not only medical care but also integrated care and support, and this applies both to the patients and to their carers as well. Regarding dementia patients who stay at home, that is, out of nursing homes or other institutionalized care, Keski-Suomi in Finland appears as the region where the patients have the highest quality of life, and so the least amount of hours of care is required for them. This finding is in accordance with the fact that the dementia patients who stay at home are at early ages of the disease because the severely demented patients stay at care homes. This is not the case for all the other study regions, where severely demented patients were found to stay at their home. When these other study regions are compared to Keski-Suomi in Finland, findings substantiate that the worse the state of the dementia patients, the additional and more hour of cares needed to be supplied. In the same direction leads the finding that lower quality of life of the carers is associated with additionally more hours of care offered to the patients. It is evident that the health and social care systems must offer support to the carers of the demented patients. The examination of the outcomes achieved in relation to costs and resources consumed is a major tool for the investigation of which processes and operations of the regional health systems under study have the potential to lead to efficient use of resources.